going to talk about how to set a patient up for a right knee isokinetic exercise. This will be similar in doing an isometric exercise as well. But if the camera operator would come up, we are in the biofeedback setting where we would do CPM normally. So if we click on the exercise, you can see that the screen changes. And when we click on patient, it pulls up this screen. Now, if you don't have a patient that is already in the computer, you click on add patient and then you put in these three red labeled and their gender, dominant side, and the affected side that you want to be treating. But just to make things simpler, I am already in here and I'm gonna have Jamie do an exercise under my name. So if the patient's already in there, we click on this. If we see an exercise that we want to perform, we can click on that exercise and just hit repeat and it goes straight to that exercise. I don't see an exercise there that I want to repeat, so I'm going to click new here, and then I'm going to have to go up here and click on protocol. When we see this screen, we can do isokinetic unilateral, which is what we'll do today, but there is isometric knee choices there, isokinetic, knee, unilateral, and we have a test already set up, or an exercise already set up, and then from there we would just set the patient up on the dynamometer head like we did in the CPM video. The dynamometer head is set at 45 degrees rotation, 0 degrees tilt. The chair is set at 45 degrees rotation, and the knee is in the middle of the bolt that attaches the attachment to the dynamometer head. Let me show you this, and then I'll have Jamie do one set for you just so you can see how it progresses through. Okay, so have the patient kick out and we'll set the away limit. Get her into full extension. If they can't come into full extension, you may have to put them there. She goes into full flexion and then about that. All right, so typically we have the patient start in the flex position because the first rep that will be recorded is the extension rep. So have the patient bend all the way. We hit start. You can either have them start on their own, you can tell them to start, but go ahead, Jim. She kicks out, kicks up. You can see these bars moving up and down, registering the amount of torque that she's putting through the machine, and yeah, rest. The machine is a half a rep behind, so she has to make one initial movement into extension one last time before it registers that rep, and then she gets a 30-second rest break. The rest break can be changed in the protocol settings, and that's about it. She's fixing to go into the next set, and
Is this one easier or hard?
it's going to be faster.
Oh.
Yeah. You can see that set is a little bit faster than the other one, and she will continue to progress a little faster, and every time the reps increase rest.